Hey guys, ECRG here, and today we're going to be talking about why CRO turnover is so high. Hey guys, ECRG here, and today we're going to be talking about why CRO turnover is so high. First of all, in the last few years, there's been more and more clinical trials that have been offloaded onto the CRO's shoulders. So there's more and more business to be done. And that creates more and more opportunities just as it is. It creates a higher demand for CRO employees. So the industry turnover rate, typically on the monitoring side of things, is about 20%, can go up or down a couple percent depending on the year. But that is a really high turnover rate. And the turnover is most pronounced in the CRA role because they travel a lot, about 65 to 75% of the time, and it's associated with really high burnout rates because of that frequent travel. So because the demand of clinical trials has increased and there's always jobs opening, the CRA always has some place to land if they don't want to work with that company anymore, or if the company just wants to throw money at the problem, which they often do. So they have opportunities. They can go to other CROs and land, make even more money than the company they're already at. So it all just works out and it creates a vicious cycle. So when one person leaves, another person can come in, and that becomes their second company, or that becomes their next company that they work with or for, and it just becomes a vicious cycle. Other places in the CRO have a less turnover, but still turnover because of the increased demand on clinical trials. There's just so many open jobs. There's so many trials that need to be resourced that you can jump around. And that's one of the great things about the industry from the employee's perspective, is you have leverage because you can always leave and go somewhere else for more money with little experience. It's highly sought after and it's highly in demand experience. So that's one of the things I greatly enjoy about the industry, knowing that if I want to leave, I can leave and be rest assured that my skills will be good enough to get me a job somewhere else relatively easy. The CRO industry is one of those things where I've heard that once you get your foot in the door, you're good to go for life. And that's really good to know, because a lot of times industries go up and down and a lot of industries go out of business totally. And the CRO industry has been pretty strong for the last few decades, so that's good to know. Another reason why the CRO turnover is so high is companies aren't creatively thinking about ways to limit the turnover. They're just doing this age-old problem of throwing money at it. And if you're a six-figure employee or over six figures, if a company's just offering you a few extra $1,000s to stay, or where another company is going to give you $15,000, $20,000 sign-on bonus, I've seen up to $25,000, $30,000 sign-on bonus. I mean, where are you going to go? You're obviously going to jump. I mean, a few $1,000s is nothing compared to $20,000, $30,000. So companies really have got to get creative about what they can do for people to stay. I know one of the things that people always talk about with CRAs especially is, well, I guess really any remote employee, but CRAs really only develop strong relationships with the site, people at the site level, and no really strong relationships with people in the office because they're remote all the time. So if you're a CRO and you're listening to this, do not make your CRAs go in the office, because that's another turnoff. CRAs do not want to be in the office. People love working from home. They love working remotely. So embrace it. You've got to be more creative. You've got to think about what will make them stay, be more loyal, without having the ability to jump around and not having to pay money, a few $1,000s, as an incentive for them to stay. It's a weak incentive. Be more creative, think deeply. I've done a video on things you can do to limit CRA turnover. You can watch that video for some tips that I came up with. We'll probably do another video soon about that as well, because this is a very hot topic, CRO turnover. It's not just CRA positions that are turning over, it's the lower level positions as well. Typically after a year of experience as a CTA role, project coordinator, project specialist, study coordinator, you name it, whatever it is, somebody will jump to another position because because the position that they're moving to, even if it's the same position at another company, they'll pay you significantly more to do the same job. So if you're coming in at $40,000, the company will pay you $50,000 to do the same job. And $10,000 is a lot of money if you're only making $40,000, right? It's a 20% bonus about. So companies got to get creative there as well with how to limit the turnover on the entry-level positions too. And once again, you can probably use some of those strategies I talked about in the CRA video of how to limit CRA turnover. But yeah, it's all has to do with good things in the industry, particularly the high demand in the supply of clinical trials in the industry and all over the world, which is a good thing. There's more clinical trials, more research is getting done, better for science, better for patients in the long run, better for the industry as a whole. So there's nothing to complain about there, because if there's less clinical trials, there's going to be less CROs and less money being made for the CROs. So you kind of want to be careful with how you think about the turnover. Yeah, the turnover is high, but there's a reason why it's high, because business is booming. So that's a good thing to think about and a good thing to keep in mind. But yeah, just creativity, thinking out the box on how to limit it. One of the last reasons why CRO turnover is so high is because, for the most part, I think there's poor management. There's poor line management in it. Line managers don't typically take the time it takes to really get to know what motivates your CRA. Of course, money is not everyone's motive, because a lot of money is being made. So the more money you make, the less and less money is an effective motivator. So you really got to go in there and dig in to what really motivates each employee. And it's not going to be the same for everybody. It's going to be different. So that's why you really need an effective management style, an effective management team in place to understand what is going to motivate each employee. And the manager needs the authority to act on that. I mean, they don't need to go all the way up so high in the department just to act on what is going to make a CRA, or just using CRA as an example, a CRA happy in the position. They need the authority to be able to act on that up to a certain extent. If an employee wants more non-travel days, or wants to be able to come into the office because they feel lonely, or if they want a little bit more work from home time, the manager needs to be able and have the latitude to implement that into the team. All right, guys, there's my 2 cents on why CRO turnover is so high. I hope you enjoyed this video. Like always, leave a comment down below, like this video, share with everybody you know in the clinical research industry. And you can always email us at eliteclinicalresearchgroup@gmail.com if you want us to do a resume review for you, or any other business inquiries you might have. If you want to be interviewed on the show, if you're an industry professional, you want to be interviewed. Also, yeah, we're trying to do some interviews for the podcast. We're rolling out a podcast and just interviews on YouTube here. There will be anonymous interviews if you want. We'll do just voice only if you want. Whatever you want. If you want your face to be shown, we can do that too. But I think most people do not. They want to be kept anonymous, but they still want to be able to contribute to the community as well. So we can do anonymous. We might be even able to disguise your voice a little bit too. Actually, I think we can do that. We can do that for sure. So email us or comment down below. You can email us at eliteclinicalgroup@gmail.com. As always, take care, guys.